Thank you, Michelle, and thank you for having me here today. As Michelle said, I'm a physiatrist. I work at a spine center at the Fort Myers Clinic. I treat chronic pain and spine pain, any kind of pain, but I am also a lifestyle medicine doctor. I am currently in training in my functional medicine certificate through the Institute of Functional Medicine, and I try to incorporate lifestyle into my practice. And the way I look at lifestyle medicine, there's 4 major pillars. Nutrition, what you eat makes a difference. How you exercise, that's the second pillar. Mental well-being, happiness, and avoidance of toxins and infections. So those are 4 pillars of lifestyle medicine that I apply in my clinic when I'm treating my chronic pain patients, when I treat my patients with back pain. Today we're going to be talking about just the first pillar, which is nutrition. And the question that I pose to you is, can your meal influence your pain? Can what you eat make a difference? Can that McDonald's meal versus fruits and vegetables make a difference in how we feel, how our pain patients respond? And we're going to go through the evidence and we're going to see yes or no. And I'm going to try to help you figure out and answer that question. So this is a journal, Pain, of the International Academy of Studies in Pain. And this was published in 2012. And they ask, does it matter what pain patients eat? Optimizing your diet, can it make a difference? Do we want to increase the food stuff that reduces pain and restrict food stuff that decreases pain? So my objectives, we're going to talk about oxidative stress lens. There's many ways of looking at nutrition and pain. You can look at the oxidative stress. You can look at different nutritional sensitivities. You can look at leaky gut syndrome. A lot of different lenses at looking at chronic pain through nutrition. We're going to focus mostly on oxidative stress. We're going to look at oxidative stress in pain disorders, dietary interventions in pain, and antioxidants and anti-inflammatory diets, and the contents of these foods. So oxidative stress is involved in every system of your body. It's involved in pretty much all of your chronic disease processes. It's involved in cardiovascular disease. It's involved in cancer. It's involved in asthma. Anything you can think of, oxidative stress is likely involved. And it is also involved in chronic pain disorders. So what is oxidative stress? Who's heard of oxidative stress in the past? Has anyone heard that? I mean, I'm assuming, being the osteopaths that we are, we've heard this before. So oxidative stress is like the rotting of an apple. It's a physiological process where we produce free radicals. When we eat, when we have metabolic processes, free radicals are produced. And then we have antioxidants that neutralize these free radicals. But when there's not enough antioxidants and too many free radicals, we have oxidative stress. And as I mentioned, oxidative stress has been involved in pretty much any chronic disease process or cancer you can think of. And not all oxidative stress is bad. We need some oxidative stress. We need some free radicals. Our macrophages, neutrophils, produce free radicals. When they're fighting bugs, when they're fighting infections, they give a little burst of oxidants, and then our body needs to clean that up with antioxidants. So we need some, but when we have too much, that's when we get into oxidative stress. So when I was in medical school and residency, but medical school, we had maybe one or 2 hours of nutrition, and we've learned the classic antioxidants. Who's heard of these in the past? The ACEs. Right, vitamin A, vitamin C, vitamin E, and selenium. But now we realize that there is a whole lot of antioxidants. Phytonutrients, phytochemicals, which are found in plants. We have about 8,000 plus phytonutrients that we know, and probably in the next few years we're going to have 20,000. There's an abundance of antioxidants in plants, and these antioxidants, what they do, they protect the plants. So plants actually produce antioxidants in order to protect themselves from stressors. So let's say bugs or infections attack a plant. The plant produces antioxidants to protect itself. And that's when we eat the plants, that's when we get those antioxidants. And the plant actually likes to produce it on the outer layer. So it likes to produce it in the skin and the subcutaneous tissue. And that's where, when we eat fruits and vegetables, when we eat the whole fruit, we get the most phytonutrients. Again, lots of antioxidants. And we're looking at the flavonoids, we're looking at the pigments, the anthocyanins, quercetin, resveratrol, sulforaphane, ligands. So there's thousands and thousands of antioxidants that we can get from plants. And we also have endogenous antioxidant systems. NRF2, who's heard of NRF2? That's the hottest name in antioxidant theories right now. It's our endogenous systems, like the master defense system, glutathione, catalyze, superase dismutase. So these are antioxidant systems in our body that need to be turned on. And guess who turns them on? It's the plants, right? Plants, vegetables and fruits can actually turn on. They can talk to our genes and turn on our endogenous antioxidant systems. So there's many ways to measure oxidative stress in our body. We can actually measure the antioxidants. We can measure vitamin C, vitamin E, glutathione. We can measure the total antioxidant status or the antioxidant capacity, oxidant status, different enzymes. So we're looking at how the glutathione is working, looking at how catalyze is working. We can look at different end products of oxidation, so lipid peroxidation, MDA, T-bars, or the oxygen radical or absorbance capacity, ORAC. We can actually take the fruits and vegetables and see how much free radicals they're able to neutralize, or we can eat the fruits and vegetables, then take their blood, put it on free radicals, and see how much free radicals they're able to neutralize. So there's a lot of ways for us to measure our oxidative stress, and we're going to use these as we're looking at some of the science. So why do I care about oxidative stress? Well, oxidative stress actually equals inflammation. You know, this is multiple studies have shown, and this study, males and females were looked at, and reactive oxygen metabolites. So basically, after their body dealt with these oxygen or these free radicals, they were positively correlated with their high sensitivity CRP. So the more oxidative stress, the more high sensitivity CRP, more inflammation. Same thing with these 243 non-diabetic patients. The total antioxidant capacity is inversely correlated. So again, more antioxidants you have, the less inflammation you have. And why do I care about inflammation in my pain clinic? Well, inflammation is pain, right? Very often when we see the severity of pain and the number of painful joints is highly associated with high sensitivity CRP. So the more inflammation you have, the more pain you have. And that's regardless of the severity on the radiograph. So when we see patients with bone-on-bone arthritis versus just a little bit of arthritis, that doesn't necessarily tell us if they're going to have pain or not. It's more how much inflammation they're having. And then the systemic level inflammation is actually correlated of how much inflammation is found in their synovial joints. And then the synovial joint inflammation is correlated with their level of pain. So that's why I care about oxidative stress, inflammation, and pain. And again, high sensitivity CRP is associated with pain severity of chronic and acute low back pain. I see that all the time in my pain clinic or in my spine center where I work at. And actually, the high sensitivity CRP levels were associated with how much pain you felt on tests. So they took these twins and they exposed them to very cold materials and very hot materials, and depending on how much level of inflammation they actually had in their blood, that's how they responded. The people with more inflammation actually felt more pain to these stimuli. So inflammation does matter with pain. So what can increase your oxidative stress, right? Wrong food, and that's what we're going to talk about, the wrong diet. But there's a lot of things that can increase your oxidative stress. Our psychological stress, smoking, strenuous activities, infections, toxic exposure, injuries. When they see patients with spinal cord injuries and they see them in the hospitals, they've actually measured their oxidative stress. It goes up significantly in their spinal cord, in their body. So a lot of things can influence our oxidative stress. So food stuff, what we eat can make a difference. If we go out to McDonald's and have, a Coke and some burgers and fries, boom, your antioxidant level drops, your oxidative stress goes up. But in this study, they looked at people, took them to McDonald's, and they fed them blueberry powder. I don't know why powder, but they fed them blueberries. Guess what? Their oxidative stress wasn't so bad. Their actually antioxidant levels went up. It only went up for a couple hours because it was powder. If they gave them real food, and we'll see that later, that antioxidants levels in our blood stays up a little bit longer. So what we eat can make a huge difference. So let's talk about some of the oxidative stress and chronic pain conditions. It's involved in the conditions that I will be discussing: arthritis, rheumatoid arthritis, back pain, both degenerative, inflammatory, fibromyalgia, neuropathy, and tendinopathy. So let's look a little bit at arthritis. So in patients with arthritis, there's an increased level of oxidative stress in their serum. In this study, they looked at 15 patients with arthritis and 15 controls, and they've noticed actually that in their serum, their oxidative stress were increased. Their T-bars, their ascorbic acid was decreased. Their glutathione was decreased when compared to control. Superoxide dismutase was decreased. So again, these people with arthritis have a lot of oxidative stress. And then they looked inside their joints. So let's look in the knee joints and let's see what happens there. So when they drew out the fluids, they found out that actually inside the joint fluid there's a lot of oxidative stress. Their antioxidant enzymes are just working really, really hard, trying to work through all these free radicals. And the same thing with these degenerative arthritis that are end stage. At the end stage, when it's bone-on-bone arthritis, these patients are about to go to knee replacement. The antioxidant content in their knees was shot. Their antioxidant enzymes were no longer working. These people were almost beyond. So what can we do about that, right? Can we do something about that? Can we do something about this oxidative stress in our body and their arthritic pain? Well, there's multiple studies that show, yes, we can. So dietary intake of vitamin C is associated with lower risk of knee pain with patients with arthritis on their x-rays. And high dietary intake of antioxidant micronutrients reduces the risk of cartilage loss and disease progression. So the people that are eating the more fruits and vegetables actually progress less with their arthritis. They have less joint space narrowing. And people that have a low dietary vitamin K intake, which is what? Where do we get vitamin K? Greens, right? So people that eat less greens, this is a risk factor for knee arthritis. Greens are actually protective. Multiple studies looked at greens and vitamin K as being protective. And then when we take some guinea pigs and create arthritis in their knees by slashing up their cartilage, guess who progressed to more arthritis? The pigs that were not fed any antioxidants, they got the typical arthritic joints, and the pigs with high antioxidant nutrition actually had less arthritis development. So we live in a land of excess, yet we are deficient. Deficiency in the land of excess, as Paul Pitchford says in his book, Healing with Whole Foods. You know, vitamin C is deficient in this country. As much as we don't want to think so, it is deficient. I check nutritional status quite often in my patients. We do a micronutrient testing through SpectraCell. There's lots of companies you can do that. It's an intracellular nutritional status. And yes, these people are nutritionally deficient. So in 2003, 2004, 7,000 people were checked, and 7.1 of them were vitamin C deficient. Another study looking at 500 patients, 6% were deficient, 30% were vitamin C depleted. And what are the symptoms of low vitamin C? Fatigue, swollen joints, muscle and bone pain, what I see, bleeding and emotional changes, which again I see all the time in my chronic pain patients. So where do we get vitamin C? We take a pill, right? No, we don't have to take a pill. We eat vegetables, fruits and vegetables. We eat, papayas, bell peppers, broccoli, Brussels sprouts. Same thing with vitamin K, which again I mentioned earlier, is so protective for arthritis. You get it from your greens, spinach, mustard greens, and these are also very high in vitamin C. So in my clinic, this is my arthritis prescription. Very often I ask my patients to eat fruits, vegetables, use some seasonings like turmeric, ginger, cumin. And again, look at that graph from the study we looked at earlier. So I have patients with arthritis and they go to McDonald's in the morning, in the afternoon, and then in the evening they have dinner. Guess what? They're in oxidative stress constantly, and their joints are flaming, right? These people are in a lot of pain. But if they eat blueberries, kale, spinach, they have less oxidative stress, and these patients do better. Here's a case of a 68-year-old female that I met at one of the conferences. She's a body therapist, completed 17 marathons, climbed the Alps. This is at age 68, okay? She was actually training for Mount Everest. And she never really had much knee pain. and she tripped and fell and hit her knee, and she was having some knee pain. So she went to see her doctor, and her doctor did some x-rays on her knees, and these are her x-rays. She had bone-on-bone arthritis, yet she never had any knee pain until she fell and hit her knee. And she was a vegetarian. She ate lots of fruits, vegetables, never ate any meat, was meditating also. She practiced Buddhism, and I'm not trying to sell Buddhism, but she was meditating constantly. Very healthy person. No oxidative stress, no knee pain, even though she had bone-on-bone arthritis. So again, the x-rays don't necessarily tell us the story. I think it's more the oxidative stress that tells us more story. So what about rheumatoid arthritis? This is a study looking at 40 rheumatoid arthritis patients versus 20 controls. And as you can see on the bottom of the graph, rheumatoid arthritis patients actually had increased oxidative stress. They had less thiols, less glutathione, less vitamin C. You can see in group 2A and group 2B. And when they were treated, either with placebo or antioxidants, unfortunately this wasn't a food plan or a food treatment because we couldn't double-blind it, obviously. That's the problem with science today. Everything has to be double-blinded. But they were treating with antioxidants. And after treatment, you can see that their thiol levels, glutathione, and vitamin C actually went up. You can see on the right side of that graph. Okay, so that's great. You know, their antioxidant status goes up, their oxidative stress goes down. But what does that mean for the disease activity? So then they actually looked at their disease activity index, the RADAI. And you can see on the right side, on the bottom right of that graph, the group that received the antioxidants, their rheumatoid arthritis disease activity went down significantly. Okay, from pre-treatment of 67 to after treatment 16. Okay, and this is just antioxidants. This is working on their oxidative stress. Same thing with what I see at the spine center, spondyloarthritis. So people with ankylosing spondylitis have increased CRP, we know that, but they also have increased oxidative stress significantly. These people are walking in oxidative stress. Can we do something about them, right? Can we do something? So here's a study looking at patients with rheumatoid arthritis, and they were placed on a Mediterranean diet. So this is 26 patients on a Cretan Mediterranean diet versus 25 patients standard Swedish diet. Standard Swedish diet is maybe not as bad as SAD diet. Who's heard of the SAD diet? Anyone heard of the SAD? Standard American diet? Well, standard Swedish is probably not as sad, but not too far. A lot of cheese, a lot of meat. So they put these patients on, and they actually gave them food for 3 weeks. So as you can see on that first graph, everybody's pain level just went straight down. Hey, we got free food. Woohoo! Everybody's feeling a little bit better. But then the control group, their pain went straight up. It went up also on the experimental group, but then when they realized, wait a second, when we were eating this Mediterranean diet, we were feeling much better. So they started re-eating that diet, and you can see at week 12, their pain went down, and their DAS score, so their disease activity score, went down significantly as long as they adhere to the Mediterranean diet, which is lots of fruits, lots of vegetables, a little bit of meat. So we have to listen to our patients. A lot of patients can actually tell us this. My patients tell me, you know, I went out for dinner the other day, and boy, I hurt the next day. Are these patients crazy or not? I don't think so. I listen to my patients. So this is a study looking at 742 patients in Norway, and they asked them, you know, does food make a difference how your rheumatic disease feels? Okay, and the people with rheumatoid arthritis, 37% said yes, it has great influence on my symptoms. Ankylosing spondylitis, 43%. Look at this, osteoarthritis. 50% of patients with osteoarthritis said yes, what I eat makes a difference. Makes a difference how my joints feel. And the most typical foods were meats, wine, alcohol, coffee, sweets, and citrus. So there's a lot of foods that can irritate patients' symptoms. So again, not everybody's going to be the same. We always have to make sure that we listen to our patients. Some people don't do well with nightshades, right? Potatoes, eggplants, peppers, and tomatoes. Some patients don't do well with it, while others do very well with it. So again, it makes a difference. So some of these patients actually did some of these restrictive diets, and 46% of these patients said that during these restrictive diets they have less pain, less swollen joints, and then 15% of these patients actually did fasting. Who's ever tried fasting in the past? Well, maybe just a few of us. Fasting is a very powerful way to shut down your inflammation. Okay, you can fast for 24 hours, 36 hours, And if you have a patient with some severe rheumatoid arthritis flare or any kind of rheumatological flare, put them on a fast, boom, their symptoms go down. It really decreases inflammation significantly. We do this in our healthcare system with quite a few doctors where we do a quarterly fasting. We do about 36 hours, and it's pretty interesting. For the first 12 to 20 hours, you're kind of hungry, cranky, and then you become really smart. Everything just looks really bright all of a sudden. When you start producing those ketones, your brain is just getting fed with these ketones and you're feeling great. By 36 hours, you're pretty hungry and you need to get something in your system. But it's a very powerful way to decrease inflammation. So here's another case, a 62-year-old male with ankylosing spondylitis in my clinic. He actually presented with back pain most of his adult life, construction worker, had some PT in the past, nothing really helped. He was, most of the day, was 6 out of 10 was his pain, would get, 9 out of 10 most days, worse with walking. He can't exercise because he has so much pain. He was not on naproxen daily, and we diagnosed him with ankylosing spondylitis. So I gave him the lifestyle as medicine plan, as I like to do with most of my patients. Physical therapy, outdoor walking, kind of get nice and happy, anti-inflammatory Mediterranean diet, green smoothies. I prescribe smoothies. My colleagues prescribe OxyContin, oxycodone. We've heard about that yesterday, right? I like to prescribe green smoothies. Spices, turmeric, ginger, cumin, acai belt, and weight loss. After 2 months, no pain most of the time. He's walking, he's happy, lost about 12 pounds, and he's feeling great. And then I see him once a year or maybe twice a year. He falls off the wagon, we kind of bring him back, and again, he feels great. The arthritis prescription. Again, you can choose. When you wake up in the morning, you can choose, I want to have inflamed joints. I'm going to go have McDonald's. I'm going to eat bad food. Or you can make a choice. I'm going to wake up, I'm going to eat well, I'm going to exercise, I'm going to be healthy, I'm going to be thankful for my day. A reason to season, right? Turmeric, ginger, and cumin are very anti-inflammatory. They decrease COX-1 and COX-2 enzyme activity. They decrease LOX5, TNF-alpha, cytokines locally and systematically. So I usually prescribe turmeric in food, that's most commonly, but also sometimes on patients who are really inflamed, I sometimes prescribe it in capsules or in pills just to kind of get their inflammation down. And as they get better with their diet, as they get better with their lifestyle, as they get happier, we slowly wean them off pills and use food, because food is medicine, not supplements. I mean, supplements can help us a little bit, but food is the real medicine. And usually we want to combine them. Turmeric and cumin actually are synergistic. Okay, when you combine those two in cooking, and then you add a little pepper and maybe some fat, like in Indian meals, like you got the ghee and everything else, it's synergistic. It really works together and decreases that inflammation. What about oxidative stress in our blood vessels, right? So oxidative stress leads to atherosclerosis. We all know that. It causes plaques in our blood vessels, but actually it constricts our blood vessels. So Dr. Vogel and colleagues, that's some really cool studies. They looked at patients, they did an ultrasound Doppler on their arteries, and they checked their blood flow. They took them to McDonald's. I'm sorry, McDonald's again. It just keeps on popping up. And they checked their blood flow afterwards. And guess what? Their blood vessels constricted for about 2 to 4 hours afterwards. Okay? So do you think they had good blood flow during this time? Probably not. So for about 2 to 4 hours afterwards, their blood vessels were in a shock. They're like, oh no, please help me. And they were constricted. Their blood flow was down. So now think about this. Morning, lunchtime, and evening. If you eat a meal that's a sad, standard American diet meal again, your blood vessels are just constantly constricted. You're not getting the blood flow where you need to. And in my world, the artery is supreme, right? A.T. Still said, artery is supreme. We need that arterial flow to our spine. Look at these beautiful radicular arteries. I love this picture because it shows me so much how the arterial supply to the spine is so important. Right? It innervates these nerves, innervates the bones, the discs. So when these patients are walking around in an oxidative stress and their blood vessels are just constricted, do you think they're getting good blood flow to their radicular artery or to their nerves, to their blood vessels, to their vertebral discs? Do you think these things are at risk for injury, for fracture, for a disc herniation? Here's a good study looking at atherosclerosis and low back pain. This basically show that atherosclerosis of the abdominal aorta, especially stenosis of the lower lumbar and sacral arteries, is highly associated with the degree of degenerative disc disease. Well, that's interesting. We just talked about that. Okay, and there's a significant association between atherosclerosis of the aorta and lower back pain. So who has seen these kind of pictures where you see a lateral view of the lumbar spine and then there's that little calcification right in front? That's the abdominal aorta, and I see this every day in my clinic. This huge calcification in the abdominal aorta, and yes, these people are in pain. And according to these studies, the more calcified that aorta is, the more likely they're going to have degenerative spinal disease, and that's what I see in my center. Again, artery is supreme, right? And again, oxidative stress in the intervertebral disc is very highly associated with how much macroscopic and microscopic degeneration exists. So what do? I tell my patients, eat greens 3 times a day. Who's seen Dr. Esselstyn in movies or has seen his book or read any of his? I strongly recommend. Dr. Esselstyn has a book called Prevent and Reverse Heart Disease. And he had these patients who were about to die. They were told, you're going to have 6 months to live because your heart disease is so bad. So he put them on a very strict vegetarian diet. Again, this is probably more strict than most of our patients can handle, but his patients were very sick. And he had them eat greens 3 times a day. And within 30 days, they repeated their angiography, and their coronary arteries opened up. Poof! Like magic. Okay, just they opened up. The plaques went away, and these people survived for years and years and years, as long as they maintained that vegetarian diet and the greens 3 times a day. So I wanted to ask myself, can I do greens 3 times a day? Who does greens 3 times a day? Anyone in this room? I strongly recommend you try. Oh, there we go. There's a few people right there. So I did. Here's my breakfast, greens for the morning. Here's my lunch. I have kale and other things and some bone broth. And here's my dinner. Greens 3 times a day. Keep the artery open and doctor away, I guess. What about fibromyalgia? Fibromyalgia is another one of those diseases that everybody is so afraid of because these people are very needy and have a lot of pain. Again, a lot of oxidative stress. So this study looked at fibromyalgia patients versus controls, and again, the more oxidative stress, the more pain they had. So in this graph on the right, the more antioxidants they had, the less pain. The less antioxidants, the more pain. This is another study looking at patients with fibromyalgia, and again, looking at their oxidative stress markers. So these patients with fibromyalgia have more lipid peroxidase. Remember, we talked about that's one of those metabolic markers we can see for oxidative stress. They have less functioning catalase, glutathiones, and these people are in a lot of oxidative stress. Can we do something about it? Here's a study looking at raw vegetarian diet in patients with fibromyalgia. They recruited 20 patients. It was a very strict diet, so only 20 patients stuck around for the full study. But they did, 7 months. And at 7 months, these people had significant reduction in their fibromyalgia impact questionnaire. So as you can see in the graph on the right, their physical impairment went down. They feel good, it was better. Their work missed, decreased significantly. Okay, these patients did a lot better. What about diabetic neuropathy? How many of you see patients with diabetes and neuropathy? I'm assuming probably everyone, because as we heard on the previous question, diabetes is on the rise, which it doesn't really have to be. We can make a choice, but unfortunately it is with a sad diet. But 20% of patients with diabetes have diabetic neuropathy, and it's associated with poor glycemic control and the duration of diabetes. And there is increased free radicals. There's increased oxidative stress in patients with diabetes. So here's that study looking at patients with diabetes and peripheral neuropathy. And patients with that peripheral neuropathy had an increased plasma level of superoxide. Remember, that's one of those free radicals we were measuring earlier. Decreased levels of vitamin E to lipid, decreased vitamin C. So these people have a significant amount of oxidative stress. Can we do anything about it? Here's a really cool study. It's in 1994, published in 1994. I shared a study with one of my neurologist colleagues, and she's like, why aren't we doing this? Why aren't we treating our patients like this? So this is 21 patients in a 25-day live-in lifestyle program. Okay, and they were placed on a vegan diet with some walking, some bike exercise, some group sessions. So they were given the lifestyle medicine approach, right? And within 4 to 16 days, they had no diabetic neuropathy pain, okay? This is even before their glucose control, before even they decreased their medications. Their pain significantly decreased, okay? And this is, again, they were very high antioxidant meals that these patients were getting. So can we do something about this, right? So how do I treat diabetic neuropathy in my clinic? I put them on vitamin G, right? Who's heard of vitamin G? Yeah, gabapentin, right? Everybody's on gabapentin nowadays. No, I do not use vitamin G. It seems like everybody with neuropathy now is on gabapentin. And what are the side effects? I mean, these people are walking on like zombies. They gain weight. So no, we don't do that. We do something better. We put them on a nutritarian diet. Who's seen this book? If you haven't, I strongly, and again, strongly recommend you see this book. You buy this book, you read it, you can get it on Audible, you give it to your patients, The End of Diabetes. And guess what? I've given it to my patients, and I've seen end of diabetes. Patients actually resolve their diabetes when they follow this nutritarian diet. It's very high in antioxidants. There's different plans we use. Sometimes we do a mitochondrial food plan from the Institute of Functional Medicine. Again, lots of beans, lots of nuts, lots of berries, lots of antioxidants. The idea is to just bring down their oxidative stress. Sometimes we use gluten-free diets depending if they're gluten sensitive, because there are some studies that looked at gluten, the protein in gluten gliadins actually can mimic some proteins in our nerves, and our immune system can actually attack the gluten and then looks at our nervous system. Oh, that looks pretty similar, and attacks our nerves too. So if you have gluten sensitive patients, which there's quite a few out there, make sure you take them off gluten, and their neuropathy may get better. We eliminate neurotoxins like pesticides, alcohols, drugs. Sometimes we give them vitamins, supports, and some exercise. So again, a lifestyle approach to a neuropathy. Here's another case from my clinic. A 33-year-old female presented with numbness and burning in her feet for about 1 year, has chronic back pain, headaches, acid reflux, IBS, some painful scars, and she's pre-diabetic. How many of you have seen patients like this in your clinic? I mean, these are very common patients, right? And she was on vitamin G, right? She had brain fog all the time. So she was on PPIs and Furosets. Horrible diet. Sweet tea, snacks, chips, no fruit and vegetables. So I did an EMG on her, and it confirmed a sensory motor neuropathy in her feet. So how do we treat her? We gave her a lifestyle approach. We put her on a nutritarian, gluten-free diet. She did have gluten sensitivity. We put her on some B-complex, some physical therapy. I did treat her abdominal scars, because sometimes those can contribute to neuropathy and pain syndromes. Within 3 months, neuropathy resolved. Poof, it's gone, okay? No more neuropathy. Lost 25 pounds. Her back pain is about 80 to 90% better. Headaches are 50% better. No acid reflux, so she stopped at PPI. And there's so many side effects of PPIs, and this is something we need to be constantly conscious of. Most of her meds. This is not just one case. I see this every day. These are my patients. I see them. Within 2-3 months, these patients turn around, as long as they play the game. If they are able to play this lifestyle game, they do better. If they don't, then it's a little bit more difficult. So antioxidants have been also studied in tendinopathies, chronic tendinopathies. This is looking at 40 athletes for 3 months duration. Half of them were put on just ultrasound and antioxidants versus the other half ultrasound and placebo. And you can see within 32 days their pain score significantly decreased. And also most of them returned to their full sporting activity significantly quicker. So we talked about these dietary antioxidants and these chronic pain conditions, right? It makes a difference in all of these: arthritis, rheumatoid arthritis, back pain, fibromyalgia, neuropathy. So now what's the best diet? I always get a question. Should I be vegan or should I be paleo? I like to walk the middle path. I like to eat a little bit of this, a little bit of that. I usually say JERF. Just eat real food, mostly plants, not too much, as Michael Pollan says. Again, you got to understand, not every diet is great for everyone, okay? Vegetarian diet is not for everyone, and I am not vegetarian, but I eat mostly plants. I would say about 80 to 90% of my diet is vegetarian. And I have some patients, like I have some patients with collagen disorders, like EDS. When I have a patient, when she stopped eating meat, she actually got worse. She needed those conditionally essential amino acids from her diet. So there's lots of different food plans, and I encourage you, if you are going to do nutrition medicine in your practice, you have to be able to try different things. You know, we have the core food plan, which is a Mediterranean diet, vegetarian diet, midal food plan, elimination diets. Elimination diets are extremely powerful for fibromyalgia, chronic pain syndromes, sometimes gluten-free, FODMAP diets for people with a lot of irritable bowel syndromes, a lot of different diets. And then there's a lot of food sensitivity. So I use this book with some of my patients. I strongly recommend you can read this. You can listen to it on Audible too, the elimination diet. Again, if you are able to identify some of these sensitivities to your patients, you can really help them with a lot of symptoms. And the most common are wheat, gluten, dairy, nightshades, eggs, beef, and some additives. And again, not all meat is created equal. So a lot of these studies that look at meat versus vegetarianism, sometimes they forget that actually some meats are different than others. So when you look at pasture-raised beef, is a lot higher in omega-3 fatty acids versus the conventional beef, right? And they don't have the antibiotics. And we need our omega-3 fatty acids, right? Omega-3 fatty acids are needed for cellular function. We know that they decrease inflammation, while omega-6 fatty acids increase inflammation. And most Americans, unfortunately, eat a ratio of 10 to 1 or 25 to 1. So a lot of omega-6s, which causes inflammation, not enough omega-3 fatty acids. And what do omega-3 fatty acids do? They decrease pain and inflammation and inflammatory and degenerative arthritis. Multiple studies. They actually kind of work like vitamin G. They block voltage-gated sodium channels and decrease neuronal excitability. They can increase seizure threshold, decrease neuropathic pain, and decrease neurogenic inflammation in the spinal cord and in the spinal nerves. So where can we get them? You can get omega-3 fatty acids from fish. You can get them from flax seeds. You can get them from supplements if you're a vegetarian. So 1 tablespoon of flax seeds gives you 1,500 milligrams of omega-3 fatty acids. That's a pretty good dose, right? What are the typical doses of supplements that we take? Maybe 500, 1,000. I tell my patients, put some flax seeds in your cereal or in your smoothie. Again, I tell them, just eat real food, mostly plants, not too much. So where do we get these antioxidants, right? You know, does everyone have to be popping pills to get antioxidants? So antioxidants are found, obviously, like I mentioned earlier, in foods and vegetables and fruits. And it makes a difference on what we get. Like some of the most powerful antioxidants fruits are blueberries. And it's not the big giant blueberries that you get in your store. It's usually the little tiny wild blueberries. So my wife comes home very often from Costco with this big bag of frozen blueberries. They're little wild ones, organic ones. Very powerful. You can use those in your smoothies. You can use them in anything. And we'll talk about the processing, but freezing does not make a difference in their antioxidant content. Again, red beans, so the beans and berries are very potent antioxidants. Artichokes, prunes, raspberries, any kind of berry you can think of is very likely to be high in antioxidants. So it doesn't matter, do we take it in pills or in foods? I again say, let's eat foods that are high in antioxidants. So Dr. R.H. Liu did a lot of cool studies on antioxidants in foods versus in pills. This is one of them. He took 100 grams of an apple, which has only 5.7 milligrams of vitamin C, and he wanted to see how much oxidants can it battle, how much can it reduce of the free radicals. And it was equivalent to 1,500 milligrams of vitamin C in a pill. Okay? 5.7 milligrams of vitamin C in an apple did just as much as 1,500 milligrams of vitamin C in a pill. So again, I tell my patients, eat the real food, and skip the pills. Sometimes we use them originally when the patients come in and they're just so nutritionally deficient. We may want to kind of ramp it up a little bit, get them some nutritional supplementation, but eventually we get them on food. And color makes a difference. Color matters. Dr. Liu, again, in his studies looked at different raspberries, and the pale raspberries, guess what? They didn't have as much antioxidants versus the really bright red ones, the dark red ones. The darker, the more colorful the fruits and vegetables are, the higher in antioxidants. So do these antioxidants actually get into our system? So this is a study looking at different foods and then measuring blood levels of antioxidants. So on the left, we saw that graph before. You go to McDonald's, you eat a meal of burgers and fries, and your oxidants or antioxidant status drops. But if you eat some blueberries, it will protect it. The middle graph looks again at some oranges and kiwis and strawberries. So look at that. When you eat the real fruit, for about 3 to 4 hours, these antioxidants are in your blood. Within 1 hour after eating blueberries or strawberries, these antioxidants are in your blood. They're bathing your bones, your joints, your nervous system. So if you eat fruits and vegetables for morning, lunch, and dinner, you're just bathing in antioxidants. And your symptoms go down. And this is what I'm trying to teach my patients. Food is medicine. And these are my favorite, the DNA whisperers. As we mentioned earlier, there's a lot of endogenous antioxidant systems like the NRF2 and the glutathione. So there's chemicals in these vegetables, like the cruciferous vegetables, like sulforaphane is just one of them, that actually talk to our genes. They whisper to our genes and they say, hey, why don't you turn on some antioxidant systems? Okay, so sulforaphane, very powerful. It actually turns on antioxidant systems in our nervous system, in our brain, in our spinal cord, in our peripheral nerves. And then our own body's like, yes, I am going to be an antioxidant machine. I'm going to beat these free radicals. So it decreases inflammations in spinal cord, and it decreases neuropathic pain and central sensitization. So you think in my pain clinic, in my spinal clinic, this makes a difference? I prescribe broccoli every day. Again, my colleagues prescribe OxyContin, oxycodone. I like to prescribe broccoli. Other DNA whisperers, we talked about these earlier, turmeric, quercetin, cumin, blueberries. So quercetin is found in red onions, green onions, apples, celery. And these things, if you put them in your food, it will talk to your genes and will say, hey, let's turn on some antioxidants. And you're going to decrease your oxidative stress. It does make a difference how we process our foods, though, right? If we take a cucumber or an apple and we take off that peel, guess what happens to their antioxidant value? What do you think? Yep, it goes down, right? Because where are most of the antioxidants? In the periphery. So as I said earlier, these fruits and vegetables, they use their antioxidants to protect themselves, right? And where do they need to do most protecting? It's in the periphery, it's in the skin. So when you take off the skin of your cucumber or of your apple, guess what? You're missing about 1/3 of your antioxidants. So I do recommend, you got to wash them and probably do more organic, but keep that. Same thing with boiling. Boiling probably is not the best thing. Steaming, some vegetables actually increase their antioxidant capacity or their antioxidant availability. So when you steam some vegetables, even though you might lose a little bit of antioxidants, but they become a lot more available. Your body now is able to assimilate them. Your stomach doesn't have to cook them so much. Okay, you can break them down easier, and these antioxidants are a lot more available to you. Freezing actually doesn't decrease it, especially blueberries. So that's why I said we usually go to Costco and get the big bag of frozen blueberries, because the frozen blueberries are just as good as the non-frozen one, and they can stay a lot longer. And if I tell my patients, buy a bunch of blueberries, they can keep them in their freezer and not worry about spoilage. So what about organic versus non-organic? Is it just a hype? So, in one part, we need organic foods because they have less pesticides, and as I said, in the 4 pillars of lifestyle medicine, avoiding toxins was the 4th one. Well, pesticides, I think, are horrible, and I think that's a whole different lecture. There are neurotoxins and increased risk of Parkinson's. I'm seeing more ALS patients now with all these exposures to pesticides. So that's one part of organic. But the other one is organic fruits and vegetables have higher levels of antioxidants. And why is that? Why do they have more antioxidants? What do you guys think? So when you have a regular plant and it's sprayed in pesticides, nobody wants to attack it. It just kind of hangs out. It's like, I don't have to protect myself. I'm just going to grow tall and big and puff up. I don't have to worry about anything, right? So then you have an organic plant and doesn't have any pesticides and has little bugs attacking it, little viruses and other things like, oh no, I need to protect myself. Guess what? Guess what it makes more of? Makes more antioxidants, right? So these organic fruits are just protecting themselves. Actually, the fruits that are bitten have higher antioxidant level because they realize, guess what? I have to protect myself. So again, my prescription for my patients is a green smoothie. This is a typical green smoothie I prescribe. Kale, pineapple. Pineapple has a lot of bromelain, so that's very anti-inflammatory. Blueberries, then we put some spices, turmeric, ginger, flaxseed oil. I like the oils because when you have fat in your food, like in a salad, it actually increases your absorptions of nutrients. They did some really cool studies on salads. They fed patients on different salads, and the salads that had oil and avocados actually improved their antioxidant capacity, improved their absorption of these nutrients, versus salads without any fats. So when I prescribe a smoothie, I usually do include some form of fat in there. And flaxseed oil I like just because, as I mentioned earlier, has a lot of omega-3 fatty acids. Some patients are bitter tasters. Who's heard of super bitter tasters? So there's about 10 to 15% of patients or people are what we call super bitter tasters. They just cannot tolerate the bitterness on their tongue. They have more bitter taste buds. So we usually ask them to put some lemon, squeeze a bunch of lemon in their smoothie, and then the kale doesn't taste so bad. Even my son, my 6-year-old son, who's back here watching me today, he's able to drink a kale smoothie, and he says in the morning, "Thank you, Daddy, that was delicious." Okay? Just put a little bit of lemon, and everybody can handle it. So does it matter what pain patients eat? What do you guys think? And is it evidence-based medicine? When I joined my practice originally, I was told, "Oh, Dr. Sebastian, he practices nuts and berries medicine. He's kind of weird. He's out there. He's an osteopath." Don't say that, right? But yes, it is real evidence-based medicine, right? So I'm going to leave off, or I'm going to give you one more case. This is a 17-year-old female. Came in with widespread pain. She presents with pain, headaches, neck, shoulder, back, hips for about 1 year. No real injuries. She was in this high exercise military training program in her school, ROTC. Who's heard of that program in the past? So we have students in this, okay? She did some physical therapy. Didn't really help much. She was kind of pale, kind of sad looking. She has insomnia, constipation, polyarthralgia, GERD. Of course, she's on a PPI, because everybody with GERD has to be on a PPI, right? Has been seen by multiple specialties, neurology, rheumatology. All her scans, all her tests, everything was negative. So she was diagnosed with fibromyalgia. It's like, we don't know what's wrong with you. You're in pain. You have fibromyalgia, right? How many of you have seen patients like this? Okay, they're everywhere. It's sad. It's sad but true. So yes, she was prescribed vitamin G, even sadder, right? So she was a walking zombie, 300 milligrams 4 times a day, and some naproxen 2 times a day. Her pain on an eval was 6.5. Worst pain was about 9 out of 10. I need to be in bed. I can't go to school when she's in a lot of pain. This little girl was pretty miserable. Her diet was horrible. Juice, soda, candy, power bars, lunch, it was pizza, fries. Not a very healthy person. And her father came along, of course, because she's underage, and he's overweight. You can see that he's not very healthy. He's walking with a cane. He's got back pain, and oh yeah, I'm on gabapentin too. So him and daughter are like, oh, they have something to bind with, right? They're both on gabapentin. How nice, a family connection. So this little girl is in major oxidative stress. Would you agree? Poor diet, doing some exercise routine. So of course, we did a very nice plan for her. Lifestyle is medicine plan. Green smoothie with the protein in the morning, nutritarian, gluten-free diet, gentle yoga therapy, some sunshine therapy. Go outside, get some sun, do some walking, some guided meditation. We usually use guided meditation in our clinic. We have, sometimes we ask our patients to download an app. It's called Calm. Just like the word calm, and it's a guided meditation, and there's different types of meditations where a woman with a pleasant voice takes the patients through different meditations, and we have them do it maybe 10 minutes, 15 minutes every day. It tracks their meditation so they can kind of see how well they're doing. I asked her to do some magnesium too and some vitamin D, and then slowly taper off her medications. So this is a good lifestyle medicine program, right? So I didn't see this girl back. I'm like, what's going on? I haven't seen her and her father. So I'm like, I got a little curious because I got a little worried. This girl was in a lot of pain. She needed help. So I look at the chart and I see a phone call from her father. So I'm going to read this to you. Father called today, very upset with the pain consult. The doctor wants her to change her diet. She does not like fruits and vegetables. What is she going to eat? She is going to college soon and does not have time to make these changes. She needs something now. She needs better medication. This is sad and true. 9 months later, still in pain. I did a chart review because I'm thinking, this poor girl, still in pain. She's on gabapentin and Xanaflex now. Okay, she's got more meds. Difficulty with college, of course. Diagnosed with ADHD, so she's on Concerta. And looking for another rheumatologist to refill her medication. Pretty sad, right? And it's true. So I urge you to use lifestyle as medicine. I urge you, teach your kids, teach your patients, teach yourself to eat healthy, to exercise, to meditate, and to be happy. Thank you very much.
There's a friend of mine in Pittsburgh who got famous because he was in the movie The Concussion, who wrote a book called Longevity Factor. His name is Dr. Joe Maroon. In the book Longevity Factor, it's mostly about resveratrol, but he talked about periods where there's research that shows that if you have worms or other organisms that go through a semi-starvation period, they seem to do better and live longer because of the stress. Can you talk about that?
So fasting has been studied extensively, and the question was again about fasting, and he mentioned some studies are looking at worms that live longer with fasting. Actually, human studies have shown that intermittent fasting has been life-extending, and fasting itself does a lot of things. So when we eat and we're digesting, our body's working through all these metabolites, working through all these free radicals. But then when we're done digesting, your body's actually detoxing. So after you are done digesting and your body's not worrying about that, it detoxifies. So if you're constantly eating, your body never gets a chance to detoxify. Okay, so that's why fasting has been shown to increase your detoxification significantly. And yes, there's a lot of studies on actually longevity and chronic disease regression with intermittent fasting. And you can do fasting like a 16-hour fast every night. So between your evening meal to morning, you just fast. Or once a week, maybe a 24-hour or 20-hour fasting. And yes, that has been shown to be beneficial. Thank you.
This may be redundant, but first of all, great lecture.
Thank you.
I really enjoyed it. Fasting is defined as just water.
There's different types of fasting. When we fast and I teach fasting, we just do water or maybe some teas like chamomile or something non-caffeinated. If you are a coffee drinker on a regular basis, I usually tell my patients not to stop the coffee, have some caffeine, because they're going to go through a withdrawal, so you need to have something. But it's usually just liquids. If you can't handle it, sometimes we do a clear liquid diet fasting, where it's just broths. But usually it's just a liquid most of the time. But there's different types. Some people fast on just fruits. So there's different definitions of fasting.
But a true fast wouldn't be drinking a bunch of apple juice.
No, because it's caloric. So yes,
right.
You want to drink non-caloric beverages that don't have any sugars or anything like that, just like tea and water.
And then second question is what do you think of Juice Plus?
Juice Plus. I'm not familiar with that. What is Juice Plus?
It's a MLM that they claim in a little tablet gives you all of your servings of fruits and vegetables for a day. Like
I said, I believe food is medicine. Juicing itself, it has been shown to actually not give you the antioxidant, but also it gives you a quick surge of sugar. So when I ask my patients to do smoothies, not juices, I have them keep all that roughage in there because of the sugar, it doesn't go up. But again, I think if you get the real fruits and vegetables, they work much better. As you remember in one of the studies that I showed, the powdered blueberries that were used to counteract that oxidative stress after a McDonald's meal, it only lasted for about 2 hours. Okay, but then we looked at the blueberries and the strawberries, it lasted for about 4 to 6 hours. So it makes a difference if you have the fiber and the real food versus the concentrate.
Is it counterproductive to add to your green smoothie some whey protein or something of that nature?
Is the whey protein counterproductive?
Yeah.
So as you saw in my 17-year-old patient, when I gave her the plan, we did want to use some protein. Sometimes we do vegetarian proteins like green pea protein. Sometimes people can't tolerate whey. If people are allergic to cow products, we don't do whey. Sometimes you can do soy protein. So yes, it can actually help. If you feel like that is going to be your morning meal, then you can add the protein in there, and it helps to stabilize the sugars as well.
All right, thanks very much.
Thank you.
Hi there. I don't know if you can speak to it, but how do you feel about the organic pesticides or fungicides like copper sulfate?
The organic pesticides?
Yeah. I mean, in organic farming, they have to use some type of fungicide, and they use copper sulfate.
You know, I don't have that much information about that, so I don't have much feelings. Again, those two, pesticides and organic, those two words for some reason don't, you know, combine very well in my mind. But you're right, they have to use something. It's unfortunately, you know, they have to use some kind of product. But from what I understand, when they studied organic products versus non-organic, the organic products, even if they were using some of these approved pesticides, still have more antioxidant content.
Well, the copper sulfate's a natural occurring compound, so they can use it as a fungicide in organic farming.
Okay.
So the natural occurring substances can be used as pesticide or a fungicide. So I don't know much about them either. I just know that that's the case.
Something to look into. Thank you.
You mentioned high sensitivity CRP. Any difference from regular CRP?
I'm sorry, what?
High sensitivity CRP versus the CRP that we order on a daily basis?
You know, in the studies that I quoted, they usually use high sensitivity CRP. I don't order necessarily CRPs or high sensitivity CRPs when I'm checking their oxidative stress, but I know in the studies those are the ones that they were used.
What's your opinion on high-level milk drinkers and inflammatory conditions?
So high-level milk drinkers, and so cow products and milk tends to be more inflammatory. Again, when you saw that Swedish diet that was compared to the Mediterranean diet, in Swedish diet they had a lot of milk products, a lot of cheese, and these people did not do very well with the rheumatoid arthritis versus Mediterranean. So I usually tell my patients to get off milk products. You know, milk is meant for baby cows, not for babies or humans. I think the milk industry has kind of swayed us to think otherwise. I give a lecture on osteoporosis, so if you ever guys want to go on YouTube and watch my lecture on osteoporosis, I go over through that, where milk products were thought to help with osteoporosis, and then we're like, oh boy, we were wrong. That actually milk products have been shown to increase the risk of fractures and osteoporosis development. So I do not prescribe milk products. I actually get my patients off of milk. And if you read Dr. Campbell's books, like China Study, where he used a casein protein in mice to actually turn on cancer genes. Okay, he was giving them aflatoxin, which produces liver cancer, and he was able to turn them on with casein, which is a milk protein, and then when he took it away, he turned them off. So I don't want my patients to have cancer and other things. I usually ask them to stay off milk products.
Thank you.
Thank you.
Have there been studies, or have you seen EMG reversal for diabetic neuropathy?
I see it with my own practice, where I do follow-up EMGs. It does reverse. And in one of my slides I mentioned, this was animal studies. I haven't seen human studies as much, but animal studies where they put them on either high sulforaphane for sciatica injury or some of the neuropathic, and they had improvement of nerve conduction studies. But there is out there, and not so much human studies. But we are going to be doing a study on diabetic neuropathy and green smoothies and a high antioxidant diet, which is going to include EMG studies. So look forward to that. Thank you very much.